Gemtuzumab ozogamicin is a monoclonal anti-CD33 antibody used to treat CD33-positive acute myeloid leukemia. In this video, let's found. What is gemtuzumab? What class of drug is gemtuzumab? What is gemtuzumab used to treat? Who cannot use gemtuzumab? What are the side effects of taking gemtuzumab? How does gemtuzumab make you feel? How to use gemtuzumab? What is gemtuzumab? What class of drug is gemtuzumab? Gemtuzumab ozogamicin, sold under the brand name Mylotarg, is an antibody-drug conjugate, a drug-linked monoclonal antibody, that is used to treat acute myeloid leukemia. What is gemtuzumab used to treat? Indicated for the treatment of patients with CD33-positive acute myeloid leukemia in first relapse who are 60 years of age or older and who are not considered candidates for other cytotoxic chemotherapy. Indicated for the treatment of patients aged 2 years and older with CD33-positive AML who have experienced a relapse or who have not responded to initial treatment, refractory. Who cannot use gemtuzumab? Mylotarg is contraindicated in patients with a history of hypersensitivity to the active substance in Mylotarg or any of its components or to any of the excipients. What are the side effects of taking gemtuzumab? The most common side effects include infection, febrile neutropenia, decreased appetite, hyperglycemia, mucositis, hypoxia, hemorrhage, increased transaminase, diarrhea, nausea, and hypotension. Pharmacodynamics. Used for the treatment of acute myeloid leukemia, AML, Mylotarg binds to the CD33 antigen, which is expressed on the surface of leukemic cells in more than 80% of patients with AML. The CD33 antigen is not expressed on pluripotent hematopoietic stem cells or non-hematopoietic cells. This gives Mylotarg the selectivity needed to target leukemic cells. How does gemtuzumab work? Mylotarg is directed against the CD33 antigen expressed by hematopoietic cells. Binding of the anti-CD33 antibody portion of Mylotarg with the CD33 antigen results in the formation of a complex that is internalized. Upon internalization, the calachemicin derivative is released inside the lysosomes of the myeloid cell. The released calachemicin derivative binds to DNA in the minor groove, resulting in site-specific DNA double-strand breaks via formation of a p-benzene diradical. Eventually, cell death is induced. Half-life. In pediatric patients receiving a dose level of 9 mg/m², the half-life was approximately 64 ± 44 H after the first dose. How to use gemtuzumab? Acute myeloid leukemia. Newly diagnosed CD33-positive AML. Indicated for newly diagnosed CD33-positive AML in adults. Combination regimen. Induction cycle, 3 mg per square meter 4 4.5 mg vial, on days 1, 4, and 7 in combination with daunorubicin and cytarabine. For patients requiring a second induction cycle, do not administer gemtuzumab during second induction cycle. Consolidation, 3 mg per square meter 4 on day 1, up to 4.5 mg vial, in combination with daunorubicin and cytarabine. Monotherapy. Treatment course consists of 1 cycle of induction and up to 8 cycles of continuation therapy. Induction, 6 mg per square meter 4 on day 1, and 3 mg per square meter on day 8. Continuation therapy, 2 mg per square meter 4 on day 1 q4 weeks. Relapsed or refractory CD33-positive AML. Indicated for relapsed/refractory CD33-positive AML. 3 mg per square meter on days 1, 4, and 7 for 1 cycle. Are there specific concerns about gemtuzumab and pregnancy? This drug can cause embryo-fetal harm when administered to a pregnant woman based on its mechanism of action and animal studies. That's all the information about gemtuzumab we collected. Thanks for listening. Do not forget to like, share, and subscribe for the HeInfo channel if you like this video, to update more health information.